You sleep every night. 8 hours, peacefully, thinking you're doing everything right. But what if I tell you? The position you sleep in could be silently causing back pain, heart problems, breathing issues, even poor digestion, and in some cases, it can even increase serious health risks. Yes, how you sleep matters just as much as how much you sleep. Today, we are going to uncover the science of sleep, the truth about sleeping positions, which position is best for you, and which one is secretly harming your body. Stay till the end, because I'll share a simple trick that can instantly improve your sleep tonight. Why sleep is so important. Sleep is not just rest. It is your body's repair system. While you sleep, your brain clears toxins, your muscles repair, your heart slows down and heals, your immune system strengthens. Poor sleep leads to diabetes, high blood pressure, depression, weak immunity. And here's the shocking truth. Even if you sleep 8 hours, wrong sleeping position can still damage your health. Does sleep position really matter? Yes, 100%. Research shows that sleep position can affect spine alignment, breathing, heart function, digestion, brain health. For example, sleeping on your back may worsen sleep apnea. Side sleeping may reduce acid reflux and improve breathing. Stomach sleeping can strain your spine and neck. Let me ask you something. Have you ever woken up with neck stiffness, back pain, numb hands, or feeling tired even after 7-8 hours of sleep? Most people think, maybe I didn't sleep enough, but the real reason might be something you never paid attention to: your sleep position. The hidden truth is, sleep is not just about duration, it's also about posture. Just like sitting incorrectly can damage your spine, sleeping incorrectly for 6-8 hours every night can do even more harm. Because during sleep, your body stays in one position for hours. Muscles are relaxed. Your brain is less aware of discomfort. So, if your posture is wrong, your body cannot correct it. What happens inside your body when you sleep? When you fall asleep? 1. Brain activity changes. Your brain starts cleaning waste toxins. This is called the glymphatic system. Some research suggests that certain positions may help better brain drainage, especially side sleeping. 2. Heart function slows down. Your heart rate decreases, blood pressure drops. But your position can affect blood circulation, pressure on the heart, oxygen flow. 3. Breathing pattern changes. This is very important. Your sleep position directly affects airway opening, lung expansion, oxygen intake. For example, when you sleep on your back, tongue can fall backward, airway becomes narrow, snoring increases. In some people, this leads to sleep apnea, where breathing stops temporarily during sleep. 4. Spine alignment. Your spine has a natural curve. When you sleep in the wrong position, spine bends unnaturally. Muscles stay stretched for hours. Pressure builds on joints. Result? Pain, stiffness, long-term damage. What does science say? Medical studies have clearly shown sleep position effects: snoring, back pain, acid reflux, pregnancy outcomes, brain health. For example, sleeping on the back can worsen breathing problems. Side sleeping improves airflow and digestion. Stomach sleeping increases spinal stress. This is why doctors often recommend specific positions for specific conditions. Why ignoring sleep position is dangerous. Let's be real. Sleeping wrong for one night is not a big deal. But sleeping wrong every night for years? That's a problem. It can lead to chronic back pain, cervical spine issues, poor sleep quality, fatigue, reduced productivity, and in serious cases, increased risk of heart and breathing problems. Imagine Ahmed. He sleeps 8 hours every night, but every morning he wakes up tired, with neck pain and headaches. He tries changing pillows, drinking coffee, even medicines, but nothing works. Finally, he changes just one thing: his sleep position. Within days, pain reduces, sleep improves, energy comes back. This is how powerful sleep posture is. Your body talks, but you ignore it. Your body gives signals. Tossing and turning. Numbness, discomfort. Frequent waking, but most people ignore these signs. These are warning signals that your sleep position is wrong. Let's simplify everything. Sleep position effects. Brain function. Breathing. Heart health. Spine alignment. Digestion. So it's not just a habit, it's a medical factor. So your sleep position is not just a habit, it's a health decision. Types of sleep positions. There are 3 main sleep positions: back sleeping, side sleeping, left or right. Stomach sleeping. Let's break them down one by one. Now let's talk about something very important. How do you actually sleep at night? Most people don't even know their sleep position. Because once you fall asleep, your body just goes into autopilot. But position affects your body very differently. 1. Back sleeping or supine position. What does it mean? This is when you sleep flat on your back, face facing upward, arms either at your sides or on your chest. Common styles within back sleeping. Not everyone sleeps exactly the same way. Even in this position, there are variations. A. Soldier position. Arms straight by your side, body completely straight. This is considered the most neutral position. B. Starfish position. Arms raised above head, legs slightly apart. Looks comfortable, but can increase snoring. What happens in your body? Spine stays aligned if pillow is correct. Body weight is evenly distributed, no pressure on joints. But tongue can fall backward. Airway becomes narrow. Key medical effect is this position can worsen snoring, breathing problems, sleep apnea. Simple way to understand. Think of it like lying flat on the floor. Good for posture, not good for breathing in some people. Side sleeping. Lateral position. This is the most common position in the world. If you observe people around you, most of them sleep on their side. What does it mean? Sleeping on either left or right side. One shoulder touching the bed. Legs slightly bent or straight. Types of side sleeping. A. Fetal position. Body curled inward. Knees drawn toward chest. Most popular position, especially in women, gives comfort and security. Too much curling can strain spine. B. Log position. Body straight. Arms by the side. Good for spine alignment. C. Yearner position. Arms stretched forward. Looks like reaching for something. D. Free fall side variant. Half stomach, half side. Not ideal for spine. What happens in your body? Airway stays open. Breathing improves. Snoring reduces. Digestion improves, especially when sleeping on the left side. Better for heart circulation. Reduces acid reflux. Best for pregnant women. Possible problems. Shoulder pressure. Arm numbness. Facial wrinkles, 1. Side. Simple way to understand. This is the balanced position. Not perfect, but best for most people. 3. Stomach sleeping. Now let's talk about the most controversial position. What does it mean, sleeping on your stomach? Face turned to one side, neck twisted. Common styles. A. Free fall position. Hands near pillow. Head turned sideways, very common among stomach sleepers. What happens in your body? Spine is forced into unnatural curve. Neck remains twisted for hours. Pressure on chest and lungs. Major medical issues. This position is linked with neck pain, back pain, nerve compression, headaches, because your neck stays rotated for 6-8 hours. Imagine this. Try turning your head to one side right now. Now imagine holding that position for 7 hours. That's what your body goes through every night. Any benefits? Very limited. May reduce snoring in some people. But overall, it is the least recommended position. Back sleeping? What is it? Sleeping flat on your back. Benefits. Best for spinal alignment. Reduces back and neck pain. Prevents facial wrinkles. Good for posture. Risks are can worsen snoring, can cause sleep apnea. Not safe in late pregnancy, reduces blood flow. For babies, sleeping on the back is safest. It reduces risk of sudden infant death syndrome. Who should sleep on back? People with back pain. People with neck issues. People who want better posture. Who should avoid? Snorers. Sleep apnea patients. Pregnant women. Side sleeping. Sleeping on your side, most common worldwide. Benefits are: best overall position for most people. Reduces snoring. Improves breathing. Helps digestion. Reduces acid reflux, especially left side sleeping. Improves blood circulation. Best for pregnant women. Helps heart function. Risks are shoulder pain, arm numbness, wrinkles. On one side. Side sleeping with proper support can reduce back pain, but poor alignment can worsen it. Who should sleep on side? Pregnant women. People with GERD, snorers, sleep apnea patients. Pro tip is: put a pillow between your knees, keeps spine straight, reduces pain instantly. Stomach sleeping. What is it? Sleeping on your stomach. Major risks. Worst position for spine, causes neck twisting, leads to back pain. Can compress lungs. Research shows it increases risk of low back pain due to spinal strain. Other problems: headaches, nerve pain, facial wrinkles, poor breathing. Any benefits? May reduce snoring slightly, can improve airflow in some cases, but overall, it is the least recommended position. Special conditions and best positions. Sleep apnea. Best is side, worst is back. Supine position worsens apnea severity. Pregnancy. Best is left side. Avoid back and stomach. Acid reflux. Best is left side or head elevated. Worst is back. For back pain, best is back or supported side. For cold/flu, best is elevated head. Best sleep position for you. There is no one perfect position for everyone. The best position is comfortable. Supports your spine. Matches your health condition. How to improve your sleep position. Simple fixes are: use the right pillow. Keep spine straight. Avoid very soft mattresses. Train your body slowly. Your body takes weeks to change position habit. So, be patient. Common mistakes people make while sleeping. Let me ask you something honestly. Do you just lie down, close your eyes, and sleep? No attention to posture? No thought about alignment? No idea what your body is going through? You're not alone. Most people make serious mistakes while sleeping, every single night. And the worst part? These mistakes slowly damage your body without you even realizing it. Mistake 1. Ignoring your sleep position completely. This is the biggest mistake. People think sleep is natural, it doesn't need effort. But that's not true. Just like sitting wrong causes back pain, standing wrong causes posture issues, sleeping wrong causes long-term damage. What actually happens? You stay in one position for 6 to 8 hours straight, without movement, without correction. So, if your position is wrong, your spine stays misaligned, your muscles stay strained, your joints stay compressed. Reality check is: one bad posture for a few minutes is okay, but 8 hours daily, for years, that becomes a problem. Mistake 2. Using the wrong pillow. This is something almost everyone gets wrong. Why pillow matters? Your pillow controls neck alignment, spine position, airway opening. Common pillow mistakes: too high pillow, neck bends forward, causes stiffness and pain. Too flat pillow, no support, neck falls backward. Hard or uncomfortable pillow. Pressure points. Disturbs sleep. Result is morning neck pain, headaches, poor sleep quality. Simple fix is: your pillow should keep your neck in a neutral position, not too high, not too low. Mistake 3. Poor spine alignment. Your spine is not straight like a stick. It has natural curves. But many people sleep in positions that twist the spine, bend it unnaturally, put pressure on discs. Common wrong habits: curling too tightly, twisting hips and shoulders in opposite directions, sleeping half on stomach, half on side. Long-term effects: chronic back pain, disc, Problems, posture issues. Golden rule. Your ears, shoulders, and hips should be in one straight line. Mistake 4. Sleeping on stomach without realizing damage. Many people say, I feel comfortable on my stomach. Yes, it may feel comfortable, but medically, it's one of the worst positions. What happens? Neck stays twisted for hours. Spine is forced into unnatural curve. Pressure on nerves. Result is neck stiffness, back pain, numbness. Important message is comfort does not always mean it's healthy. Mistake 5. Not supporting your body properly. Your body needs support while sleeping, but most people just lie down flat, without supporting key areas. Areas that need support: neck, lower back, knees, especially in side sleep. Without support, spine becomes uneven, muscles stay stressed, pain develops. Simple solution is use pillows smartly, between knees, under knees. Mistake 6. Using very soft or very hard mattress. Your mattress plays a huge role. Too soft mattress, body sinks, spine bends. Too hard mattress, pressure on joints, discomfort. Best option is medium firm mattress, supports your natural spine shape. Mistake 7. Ignoring pain signals. Your body is very smart. It gives signals like pain, numbness, tingling, frequent waking. But what do people do? Ignore it. Big mistake is pain is not normal. It's a warning. If you ignore it, problem becomes chronic. Recovery becomes difficult. Mistake 8. Sticking to one wrong position for years. Habits become permanent. Many people say, I've been sleeping like this for years, but that doesn't mean it's correct. Truth is, your body adapts, but damage continues silently. Importantly, you can train your body to change position. It may take days, weeks, but it's possible. Mistake 9. Sleeping without thinking about health conditions. Different people need different positions, but most people don't consider back pain, pregnancy, breathing issues, acid reflux. Example is, back sleeping in sleep apnea is dangerous. Back sleeping in pregnancy is risky. Your sleep position should match your health condition. Let's simplify everything. Most common sleep mistakes: ignoring position, poor alignment, stomach sleeping, no support, bad mattress, sleeping without pillow support, using too high pillow, sleeping curled tightly, ignoring pain signals. You spend 1/3 of your life sleeping, but most people never think about how they sleep. Your sleep position tonight can decide your health tomorrow. If you learned something new today, like this video, share it with your family, subscribe for more health awareness, and comment below, what is your sleeping position? I'll personally guide you, whether it's good or needs improvement. Sleep is not just rest, it's medicine. And now, you know how to use it properly.